Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Shaji Ravi. He's CEO at Access Healthcare. Welcome, Shaji.
Thank you, John. Thanks for having me here.
Yeah, excited to dive into today's discussion. But before we go there, tell us a little bit about yourself and Access Healthcare, which now is part of Smarter Technologies. Tell us about it.
My name is Shaji Ravi. I co-founded Access Healthcare in 2011, and Access grew up to around 27,000 people. That's a lot of people. Back in India as well as the Philippines. And this year, actually, we completed the transaction with Smarter Technologies, and we're part of Smarter Technologies.
That's awesome.
Yeah.
Well, you made some big news launching a new autonomous platform company for hospitals, kind of combining a lot of different technologies and organizations, bringing together Access Healthcare, SmarterDx, and Thoughtful.ai. Kudos to you and all the team that brought it all together.
Yeah.
But give us an overview of how Smarter Technologies platform works and why you decided to make a move like this that feels pretty unique in the industry to combine all of these different companies and technologies.
No, absolutely. I think technology is the key word. Mm-hmm. And, over the last 20 years, there are a lot of robotics process automation that was deployed. But AI is not a hyperbole. It is real. Everyone wants to do something with AI. I think the payers have learned that very ahead of the time. And they're far more advanced in using AI today to deny claims or, make it difficult for the providers. But at the provider side, we don't have that technology yet. And that's where we come in, with the 14 years of experience with the Access organization, which does revenue cycle work. It has the repository of all the knowledge that is required to, do the RCM work. And then you combine that with the two companies, the SmarterDx and Thoughtful, who are the top-notch AI companies. And if you bring those two together, I think it's great solution for all the providers out there.
Yeah, and I love that perspective. Like the payers are doing it. If providers don't, that's going to be a problem.
No, absolutely. And I think they have the advantage because they are early adapters to the technology. And all the hospitals and health system, I don't think there is a clear strategy on how to deploy this. And that's where technology with human loop is the answer for.
Yeah. Well, it sounds like you have a real depth of experience here. So I'd love to hear, because getting paid, and operating efficiently, it's not a new challenge. It's something that's been a challenge in healthcare for a while. So why has it been so hard, to date to be able to get this accomplished?
I think, it's a cat and mouse game, right, between the providers and the healthcare payers. And, I've been in this industry for over 30 years now. And, when I started out, I was working the claims, and every denial that I saw 30 years back, it's the same 30, denials that I see today.
Amazing.
Yeah. So it's nothing has changed, but what has happened is the cost of collecting the claims have only gone up. And, cost, that is where Smarter Technology is coming with the pointed solutions, where we're talking about how do we change the game in terms of cost to collect of every single claim. How can we disrupt the market with cheaper labor arbitrage and bringing technology into the play, and just let the providers be in the game today, and instead of playing catch up.
Interesting.
Yeah.
So tell us more, like how specifically is the Smarter Technologies AI-driven platform going to help solve some of these challenges?
No, I'll give you a simple example. So, today Access Healthcare in India and the Philippines is one of the cost leaders. When I say cost leaders, we are the cheapest vendor delivering services to physicians and hospital groups. And imagine if we deploy AI technology to our workforce, and where we can slash, maybe 30% of the cost. Look at the money that we are, putting in front of the providers in terms of how they can invest on, improving the care rather than focusing on collecting cash from the payers. Yeah.
Well, tell me more about that. Like, what is the current healthcare industry standard for how much it costs for hospitals to collect payments?
Pretty significant. I mean, I don't have the exact amount that I can quote because it will differ from every health system in terms of cost to collect. But I would say, it is pretty in the upper two-digit numbers that would be based on every single providers. And the cost remains is not constant because every year everything is getting expensive. Even the cost in India that was 14 years back, the cost in India was very different than what it is today, and it is just climbing every year. So it's not going to go down. The labor cost, at least, is not going to go down.
Yeah, that's interesting. I mean, inflation's happening everywhere, I guess.
Yeah, absolutely, and nobody gets paid for inflation, right? The payers don't pay you every year for cola.
Yeah, there's no cola on insurance payments.
Exactly.
Maybe there should be. That's really interesting. How much do you think your Smarter Technologies is going to be able to impact this? You talked a little bit about it. I love the idea of 30% reduction in cost to you, which obviously you're able to pass on to your customers. But how are you going to be able to impact that number, and maybe share some stories of customers that you've been working with on this?
Yeah. So again, cost is just one aspect that I caught up on because that's probably everyone wants to hear. But the most important is the quality of the transaction. In our industry, human error contributes significantly for the claims to recycle, and these are human errors. When we contract with the customer, we talk about acceptance accuracy of 95%, which is pretty high. What we are trying to do is to change that, and we want the 4 nines, as I call them, 99.9%, 99%. So which means if you're deploying technology and AI, your accuracy has to be top notch, almost 100%. And imagine all that quality would translate to lesser denials and more accurate working of the claims.
Interesting.
Yeah.
And any other examples from customers that you could share where you've seen the success, by using your technology?
Yeah, absolutely. I think SmarterDx and Thoughtful have already established through their technology. SmarterDx is selling like hotcakes today. Every health system and hospital wants them. And the reason they want them is the way the AI is able to predict the denials before it happens. And I think that is, we have great success stories about that. Yeah, exactly.
That's interesting. So, hospitals are spending a lot of money, right? EHRs, interoperability.
Yeah.
Never enough money for data security, right? Like it seems like.
Exactly.
And that's getting even worse in many cases. So how can they be expected to kind of aggressively invest in AI, which is the mandate that most CIOs are getting and CFOs are giving to them, or even take the same level of aggressive investment in AI as the payers, right?
Yeah.
Like, to your previous point, which maybe they don't have the expenses. Like, how can a provider compete with the payer who has been investing for a while?
Yeah, honestly, I think it's not going to happen. It's not going to be easy for hospitals to adopt AI technology by themselves. What they need is partners like us, and that's where Smarter Technology comes in, where we are talking about modular services, where we are taking all of the revenue cycle management, breaking that into smaller pieces, and we are saying we'll take each of those modular services, make it better, more accurate, and cheaper. And that by itself is, I think, going to respond to this crisis of why are the payers having this technology versus the providers missing out on it today.
Yeah, that's interesting. Is there a reason why the EHR vendors aren't offering this? Why should they work with someone like you? Many of them, especially the CIOs I know, they're like, well, eventually the EHR will give it to me. Talk about that. I'd love to hear honestly, how you see that.
I was in this conference where I saw every vendor talking about AI, and sometimes you get repulsive with just the idea that everyone's only talking AI on their LinkedIn pages or their websites, but they have nothing to show.
They haven't actually done it.
They haven't done it. So I think that's the key factor. And what we are promising is that we have a ready product. We have the people that deliver the service today. We combine these together. We give you the modular services. We don't want end-to-end work to be given to us. We will work your prior auth, we'll work your denials, we'll work your coding. We'll give you modular services where you would see high impactful services being delivered.
Yeah. That's awesome.
Yeah.
Well, Shaji, I appreciate you coming by to talk about everything that's happening with Access Healthcare and, of course, the now broader Smarter Technologies. It's going to be really interesting to see as you package the people, the process, the technology all together in one amazing package.
Thank you, John. Thank you for the opportunity. Loved having this conversation with you.
Thanks.
Thank you.
And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, Raj.
Thank you.